Okay. Hi, everyone. We're going to go ahead and get started. Hi, welcome to the University of Chicago. I'm Debbie Albert, and I'm the Chief Nursing Officer here. And I want to thank you all for joining us today as we speak about the importance of organ donation, which has come such a long way since the first successful organ transplant in the 1950s. In fact, it's so exciting to say that 2019, we're on track to set a record for the number of organ transplants taking place across the country. You might not know, but the science behind organ donation actually began here at the University of Chicago. In the early 1900s, one of our Nobel Prize-winning surgeons discovered a technique of suturing and reconnecting blood vessels and arteries back together. It's actually that discovery that then ultimately made organ transplant possible. And so now, more than 100 years later, we're really proud to say that we continue to play an important role in this field. You might know that tomorrow actually marks the anniversary of the first ever back-to-back heart, liver, kidney transplants. Many of you might actually remember the remarkable story of Sarah McFarland and Daru Smith, and then the unique friendship that they developed during their time with us as they traversed this journey. Since Daru and Sarah's groundbreaking surgeries, and likely as a result of those surgeries, our transplant teams have actually gone on to perform an additional 4 triple organ transplants for an unprecedented 6 heart, liver, kidney transplant surgeries in a 12-month period. So remarkable. And I know I speak for everyone here at the University of Chicago, our physicians, nurses, therapists, pharmacists, social workers, really everybody that supports our patients, to say really how proud and what a privilege it was to serve these patients on their journey. However, we know that stories like Sarah and Daru's and each and every one of our transplant patients wouldn't be possible without the generosity of donor families. We are also grateful for the people that take time to register to be organ and tissue donors, and then for the kindness of families to make such selfless decisions to help others during incredibly dark, unfathomable moments of grief. So, this time of year, the holiday season, you're no doubt hearing messages of holiday cheer. There's lots of parties to go to, family events to cook for, and gifts to give. But today we really wanted to take time to focus on the most important gift, that of giving the gift of life. Often the recipient being a total stranger. And so it's maybe the most important thing that we could do this holiday season. And with that, I'm going to introduce our Illinois Secretary of State, Jesse White, who will talk about the importance of registering to become an organ and tissue donor.
Thank you very much. For the women, I'm in your purse. For the men, I'm in your wallet. I think you know the rest of the story. You cannot leave home without me. I've had the great pleasure of serving as the Illinois Secretary of State for the past 21 and a half years. And of course, my other mission is to help make the roads of Illinois the safest ever. But by other capacity, I'm on a mission to give others a second chance at life or help to improve their quality of life through the organ and tissue donor program. So I'd like to thank this wonderful institution of healthcare, the Chicago University of Chicago Hospital and medical team for their commitment to helping to give others a second chance in life or helping to improve their quality of life. And I think that they're involved with more than just one person receiving a gift of life. There have been times when they put a lot of people together and wonderful things happen as a result of it. So I want to applaud, commend, and thank them for their skills, for their commitment to duty, and for giving others a second chance at life. Fortunately, many people like Daru, Sarah, Neil, Appu, and Jerry have received their gift. And we want to make sure that others are just as fortunate. Currently, there are 114,000 people waiting nationally for an organ. Here in Illinois, about 4,700 young people, better yet, not young people, people died because the organs have not arrived in a timely manner. 300 people, as indicated before, each year cannot get, 300 people die because organs have not arrived in a timely manner. And one of the things we've done, and that is we have decided to go to the high schools and allow these young people, 16 and 17 years of age, to participate in the organ and tissue donor program. Prior to that time, when they were 18, you could participate. Now it's 16 and 17. But I also want you to know, too, that those organs cannot be used just by taking them. They have to get permission from their parents. But when you get 18, then that permission is not necessary. We have a lot of individuals that we're proud of. There's a doctor at the Loyola Medical Center. She gave her patient her kidney. A teacher in New Lenox, Illinois, gave her student her kidney. And then there was a preacher who gave his parishioner his kidney. So there are a lot of people who are showing love and giving others a second chance at life through this wonderful, wonderful program of ours. 91,000 young people from our high schools have signed up to become a part of this program, and we're proud of them. And then, of course, many times people are afraid of the myths. They'll say, well, if I go to the hospital, the doctor's not going to put forth a genuine effort to save me because he's concerned about my organ and tissue parts. Well, your doctor has a commitment to you and to you only. Don't buy into the myth. Then they'll probably say, well, I choose not to participate in this program because the rich man's going to get his organs before I get mine. Well, that too is a myth because there's a process that we must adhere to. And then they may say, I may not look good by going away. Well, sometimes more tissue can make you look a little bit better. So do all you can to encourage others to participate in the program, and please tell them, don't buy into the myths. So with that, I just want to thank you for giving, thank you for caring, and thank you for making a difference in the lives of others. I'm a part of this wonderful chain where I ask individuals to sign up to become a part of this program. And then we have Mr. Spunt down there. He's involved with the extraction or getting the permission from the parents. And then, of course, here at the hospital, you take care of the procedure by which you transplant the organ from one person into the body of someone else. So thank you very much for allowing me to be a part of this team. Thank you for allowing me to come to this wonderful institution. And I just want to wish the doctors and anyone who is involved with this process for their commitment to giving others a second chance at life or helping to improve their quality of life. Thank you.
Good afternoon. I'm Dr. Valuvan Jeevanandam, the director of the Heart and Vascular Center and the surgical director of the heart transplant program at the University of Chicago Medicine. I've performed over 1,200 heart transplants in my 30-year career, and I've directed the program here since my arrival at University of Chicago Medicine in 1998. We performed the first successful triple organ transplant, heart, liver, kidney, at the University of Chicago Medicine in 1999. Just to put things in perspective, in the history of the United States was essentially that of the world. There's been only 23 triple organ transplants done ever. And out of those 23 transplants, we've done 10 of them here at the University of Chicago Medicine. And furthermore, 6 of those transplants have occurred in the last 12 months. But numbers do not really affect the human value of those transplants. And I'm so honored today that we have 4 of our 6 transplant patients here. And it's amazing how they have transformed their lives after transplant. I'm just going to kind of remember the first time I met them. Well, when Sarah, I met her in clinic, she could barely breathe and say one sentence, and now you can ask her and she can out-talk any one of you. Daru I met when he had actually had a cardiac arrest and he was practically dead, so we had to resurrect him from that stage. When I met Neil, I saw him in my office, and he could barely walk from the front of the office to the back. I don't have a big office. And look at him now, he's doing fantastic. And Purna, I didn't see you in clinic, but I did see you in the ICU, and your transformation has been remarkable. Why are triple organ transplants so rare? I think you have to find a lot of things that align. First of all, you have to have patients who have the disease process that requires triple organs, but need to have the courage and the drive and the dedication to be able to undergo a massive operation and survive. And I think that's where the courage of our patients really comes and resonates. You also have to find the organs. It's very hard to find all 3 organs from the same patient. And of course, that is where the efforts of Jesse White and of all the OPOs around the country and of the donor families come into play. And then on top of that, you have to find a team that has the resources and the commitment to do these operations. The tagline at the University of Chicago is we're at the forefront of medicine, and believe it or not, we really are, right? It comes down from the dean, the president of the hospital, to all the administrators and all the clinicians. Everybody's dedicated to push medical technology and help us help the sickest of our patients. Our team is truly phenomenal. If you think taking care of a sick patient with a heart problem alone is difficult, imagine a team having to take care of patients with 3 critical organs that aren't working. They had to allow them to survive, get them optimized, and actually get to the operating room. And then after the operating room, you have to have an incredible team that now deals with the interactions of 3 organs and all the medications and get them through to look as fantastic as they are. And in the operating room and the operating room itself, there has to be perfect synchronizations of the teams because they have to hand off to each other. It's a very complex symphony that needs to be executed perfectly. You know, an analogy is like pitching a perfect game, except we've had to do it 6 times in 1 year. I don't think anybody else has been able to do that. Transplant is truly a spiritual event. From despair and ultimate tragedy, there is rebirth and a new life. We have the privilege of seeing the heart beat for the first time in its new birth. We have the privilege of seeing a liver make bile or a kidney make urine, and it's truly a privilege to witness the miracle. We are surgeons that we can actually witness the miracles. However, the true heroes are the patients and the donor families and the professionals who work tirelessly with these families to work through the entire donation process. Without the OPO working so diligently in getting us donor organs, we would not be able to do our work. And now I'd like to introduce Kevin Schmunt from the Gift of Hope, and he will talk to you about why our message today about organ donation and organ transplantation is so timely. Thank you very much.
Thank you, Val. And thank you for the invitation to speak today. I want to start out by just thanking my friend Jesse White, who was the first guy to call me when I got this job 7 years ago and congratulate me, and has become a close friend of mine and just a tireless advocate for our donor families and for donation across the state. We're really blessed to have him. Last week we broke the record as a transplant and donation community for organ donation for a year. So every day we break that record again. This is the 7th year in a row that we've broken the record for organ transplantation in the United States, and Gift of Hope has experienced about a 75% growth in organ donation over that 7-year period. So we've seen this incredible growth, and the numbers are staggering, and the lives saved are really incredible. And people ask me, like, what do you do for a living? And the truth is, I just tell stories. And you know, the stories that we tell have to do with families on the worst day of their lives, when they've lost the most precious thing in their lives, somehow finding in their hearts to give us that gift of life, that gift of donation, and allow us to create some miracles with the help of our partners, like our partners here at the University of Chicago. Somebody asked me, like, well, why are triple organ transplants important to the donation side? And I think the answer is because it's a story. It's an unbelievable story. Val just mentioned we've done like 23 of these, 26 of these in the history of transplantation, and 10 of them have been here at UC Medicine. That's an unbelievable story to tell. And when you think about our donor families, that's what they ask of us. They ask us to rewrite the end of their loved one's story. And when we can go back to them and tell them, wow, you know what happened with your loved one? We transplanted 3 of those organs into somebody. You are so special. You're one of 26 in the history of transplantation. That's a pretty cool rewriting of that story and a great ending to that story. So on behalf of Gift of Hope, I want to congratulate all my colleagues here for a really ridiculously successful year in transplantation. And we're looking forward to 2020 and another great year. Thank you.
Thank you, Kevin. That was, just very inspirational. So talking about the gift of life is just so important at this time during the holidays. So my name is Skip Hidley. I have the privilege of leading the marketing and communications team here, and we like to say we're the storytellers of UChicago Medicine. And so one of the greatest stories we've had to tell in the last 12 months has been the story, as we stood here about this time a year ago, telling the story of Sarah McFarland and Daru Smith. So Sarah is from outside Detroit, and Daru is from here in Chicago. The two of them became very close friends, as the world has come to know, as they were waiting for their transplants. Sarah, as you may remember, received her first heart transplant when she was 12. A variety of complications over the next 17 years led to the failure of her transplanted heart. Fluid began to accumulate in her legs and abdomen, damaging her liver and kidney. Daru, meanwhile, had a rare and difficult to diagnose condition called sarcoidosis that caused clusters of inflammatory cells to form in organ tissues. In addition to impacting his heart, sarcoidosis led to significant liver and kidney dysfunction. The two of them are here today, and I think if you look at them, you can only be amazed. The chances I've had to interact with them have just been magical. So they want to share their thoughts on the importance of organ donation. At the same time, they're joined by 2 of our new triple organ transplant recipients. They are Appu Patel, who is a 45-year-old consultant from Washington, D.C., who received his triple transplants in June. He had been diagnosed with cardiomyopathy and liver cancer and cirrhosis. These health problems combined to cause kidney damage, and today the Munster, Indiana native has spent more than 100 days in the hospital and is now living in Chicago while he continues to recover. Our 4th patient is Neil Perry. Neil is a 55-year-old from Louisville, Kentucky. He was born with a hole in his heart and later developed cirrhosis, which led to kidney damage. His surgery took place in May. Today, he's also living in Munster and is going back to school to study nutrition science. Neil and Appu both came to UChicago Medicine after local surgeons referred them because of the complexity of their cases and our experience performing these types of multi-organ transplants. Now I'm going to let each of these patients share with you their thoughts. We're going to start with Sarah.
Hello. As previously mentioned, I'm Sarah McFarland. Words cannot do justice to express my gratitude for my donor donor, family, organ donation, the gift of hope, and the knowledgeable and talented medical professionals who have successfully performed my transplants. I have been blessed to receive 2 transplants, my first heart transplant when I was 11, and my triple heart, liver, and kidney transplant exactly a year ago this week. My donors have allowed me to live a wonderful and productive 18 years full of memories and of activities I love to do. The gifts have not only benefited me, but also my parents, siblings, and community. With these gifts, I have taken on the responsibility to take care of my organs and to give back. I take care of my organs by following my doctor's directions, exercising, eating, and listening to my body. Over the years, I've had hospitalizations, which I call hiccups, but despite these challenges, I have remained positive, rule-abiding, motivated, and blessed. I give back by participating in many fundraisers. I have gone to the USA Transplant Games. I have made fleece blankets for donor families, walked 5Ks for various organizations, and volunteer here at the hospital talking to pre- and post-transplant patients and their caregivers. Giving back doesn't have to be big. Sometimes it's as simple as being observant, helping with the task, smiling, giving blood, etc. I hope that organ donation can become an easier and more common conversation between families, so when a tragedy does occur, the decisions to donate organs is a known factor and not a difficult decision that a family has to decide while grieving. Responsible adult paperwork often includes where our money, children, and material things will be placed. Wouldn't it also be nice to know if the individual would like their organs to be donated as part of their legacy? I want donor families and those deciding to register to know that recipients take this gift seriously and protect their organs and live life to the fullest given the second chance. I also want to address that organ donation is often demonstrated inappropriately and incorrectly on TV drama shows and movies in an attempt to captivate audiences. This shows a careless, frivolous process. There's nothing further than the truth. I want to emphasize that organ donation is very organized, fair, controlled, respected process. All donors are given excellent care prior to any circumstance that would result in organ donation. I also want to acknowledge that it's not only the 4 of us who have received triple transplants that have benefited from organ donation, but anyone who has received any type of transplant and their families. I hope that by seeing the 4 of us as healthy, positive, and motivated individuals, that we can promote organ donation and get more individuals registered as organ donors, not only in Illinois, but nationwide. Thank you again for organ donation and for all the good it does.
Thank you, Sarah. That was beautiful. I should add that Sarah, I think, went ice skating yesterday. So that's pretty cool. So now we're going to hear from Daru.
For me, I take in everything a little more different than what I think most people do. So I just wrote a small speech to express the way that I took it in, and the way, I'm sorry, I probably need to sit up, and the way that I feel towards the organ donation. It says, for me, organ donation is the beauty of life, you know, like a freshly laid foundation on which a house is to be built. Not only does it represent a new and more stable foundation on which to stand, it also represents hope, faith, and joy. Hope is a positive state of mind which is based on the expectation of a positive outcome and with respect to events and circumstances in one's life or the world at large. Hope is for that guy that was laying in the isolation room. Hope is for that guy that was laying in the isolation room with a central line to his heart, 5 other IV medications going, all the while having heart palpitations. Hope is for that guy who couldn't stand, feed himself, or even open his hands. And then we have faith. I'm sorry, y'all. Faith. Faith is being sure of what you hope for. Faith is being certain for things that are unseen. Faith is having complete trust and belief that something that you never thought could happen for you before Faith is knowing in your heart, even when the refraction rate is only 15%, that there's hope for you. And then we have joy. I'm sorry, Al.
Take your time, Daru.
Weeping may tarry through the night, but joy comes with the morning. Joy is amongst the most unmistakable marks of a faithful heart. Even in times of doubt, the presence of joy can brighten your spirits. My joy comes from my faith. As y'all know, I believe, you know. And with organ donation, I want to let it be known, we can turn tragedy into triumph. I'm sorry, I'm getting lost for words. It's unexplainable what it can not only do for the individual, but the family. As you all can see, we are products of what organ donation can do. And I think we set pretty good standards. I want to thank the University of Chicago, the whole medical staff, Juvenandum, Becca, Baker, Dr. Smith, and then I called them my personal team, I'm sorry. Helen Tay, Dr. Coiner, Dr. Tiani Riley, Joe Dale, and yeah, the whole university, I'm sorry, y'all. That's all I got, though.
Daru, you did fantastic. Everyone would agree. So we're going to go to Appu next.
Sorry, I gotta wear the reading glasses. It's the part of age.
Yeah, pull the mic close to you if you would,
Yeah.
please. That way everybody can hear it.
Thank you very much for the opportunity to be here today and share with you a little bit about my story. In fact, all of us are here today because of the magic of organ donation. I often wonder how you thank people who saved your life. The doctors, the nurses, but most importantly, the donor and the donor's family. What words can I say that recognize the most powerful of gifts? I'm a husband and a father of 2 young boys, and I now have the opportunity to continue to share in all of their lives and watch my boys grow into men. My successful triple transplant has given me this opportunity, and all I can do to honor the gift and sacrifice that the donor has made and their family has made and the hard work of my doctors is to live the life as best as I can, to work hard, to be a loving partner and father, and to take care of these organs. It's that time of year when we gather together as families to celebrate. There is a huge contrast between the opportunity my family has now to cherish one another this season and the sadness and loss that my donor's family faces not having their loved one with them. I cannot imagine what they are going through. I just hope that they find some solace and comfort in the idea that their sacrifice has brought hope and joy to another family miles away in Washington, D.C. I too have been an organ donor for many years, but when I checked that box at the DMV on my regular visits, it was always just an abstract concept. I am not sure I fully understood or considered all the ins and outs of that decision. My perspective has obviously changed as I am now the recipient of 3 organs. I am more keenly aware of the powerful sacrifices donors and their families make and the life-saving impact it has on beneficiaries like me, and more importantly, the families that surround us and the support that surrounds us. It seems like science fiction, but I am so grateful to the donor for their gift and the medical team here at the University of Chicago for pushing the boundaries of science and saving my life. I still have trouble believing that all of this happened. It's my story, this story, our stories, that provide the tangible evidence that organ donation really is a wondrous decision. Those considering the idea of donation can just look to us and see the transformative effect it has on individuals and on the families that we touch and love. It is the greatest and often the last gift someone can give, allowing for one person to transform another life and the people they touch. Recipients like us and all those that I've ever had the pleasure of meeting are appreciative and committed to ensuring that this gift is cared for and taken care of. Not a day goes by where I don't feel gratitude for the donor, the doctors, the nurses, the entire medical team here at the University of Chicago who have supported me and my family throughout this entire journey. I thank you very much.
Now we're going to hear from Neil.
My name is Neil Perry, born with congenital heart disease. First of all, I want to say thanks to Betty Perry, my mother, who took care of me and my brother and sisters, and Diane, thank you so much, and Sarah and Daru. I didn't know him, of course. Appu and I went through it kind of together. Thanks, of course, to the donors and families. As we know, there is sorrow. I hope my good life provides some comfort in our lives here, the good life we have. It's a blessed gift to survive and live, but the blessing goes much further. I was born a blue baby and had maladies most of my life. I was never very strong or could do vigorous activity. I would be envious of athletes and others, but I did what I could do to stay fit. Now I'm strong, healthy, and totally cured. I knew I would need a heart transplant one day, but never imagined I would feel this terrific. I can jog, play ball, and work out vigorously. I can barely wrap my brain around it. I can lay claim to the greatest comeback since the Boston Red Sox. Thank you from a really sick boy from Kentucky. Thanks to my family and friends. Thanks to this institution, everyone here, the doctors, of course, and the nurses and all the staff, right to the staff, you know, they're all so important. Everybody has such a role to play and so professional. The whole time I was here, not only were they very compassionate and informational and took excellent care of me and us, but the professionalism was from the top down. You know, you got the same service over and over. And now when I'm in the community and somebody gives me bad service, it really annoys me, you know, because I know what it is to get excellent care, so you raise the bar quite high for everybody. Yeah. But big thanks to the transplant recipients before me, such as Daru and Sarah, but not forgetting the millions of folks that helped advance this technology. They are heroes to me. You guys are my heroes. You know, they blazed a trail and I went right through it. And he was behind me, and then Jerry, and now Rex is still here. And we hope he gets strong and gets better. He's getting better. Because of this inspiration from donors, I want to use my life to help as many people as I can. And I have a plan. Thank you so much.
So we're going to open it up to a Q&A, and I'm going to exercise my privilege, and I'm going to ask the first question of Dr. Baker. Dr. Baker is the liver transplant surgeon who worked on all of these cases. So we've talked primarily today, Dr. Baker, about organ donation from families whose loved ones have died. But that's not the only type of organ donation. Can you explain a bit about living organ donation and how important that is for those who are on the transplant waiting list?
Absolutely. I mean, I think our recipients here really show the power of donation, but that includes not only being able to take from really honestly a patient's terrible tragedy, but also there are opportunities for people who are living to offer opportunities for health and new starts of life by people to give people part of their organs. For example, kidney transplants, as we've heard, can come from living donation. So everybody has 2 kidneys, and if you are worked up properly and healthy and have the motivation to come forward for organ donation, you can give one of your kidneys to someone on the list, whether it be a loved one or even increasingly in our really unbelievable society for someone that you don't know, who you can really help off the waiting list. Liver transplant is also an opportunity for living donation. So we can take pieces of the liver. The opportunity to do that actually started at University of Chicago back in 1989. The first living donor liver transplant was performed by our predecessors here, where an adult gave a baby an opportunity for a new life. It's something that we feel very passionately about, but I think ultimately as a transplant surgeon, the real joy of transplantation overall, and certainly living donation, is understanding the power of the gift and understanding in today's world where things are difficult and the message that's going out is difficult. Bottom line, we are a society of givers who really do give hope and faith and joy and new opportunities for life to our patients who need new organs. So I think it's an unbelievable opportunity, and we are grateful, and it's our privilege to be part of these stories.
Thank you very much. So now we'll open it up to questions from the news media, if anybody has one. Go ahead.
I know that there's some timelines and some of the material you've given, but should you just say maybe kind of like how far out you are and how you're feeling now?
Okay, I guess I go first. My name is Daru Smith. I'm sorry. Okay, my name is Daru Smith. Tomorrow will be officially 1 year that I'm out. I would say that I feel extraordinarily strong. I have more energy than I ever thought I would have. I walked around with a bad heart for 5 years. I mean, simple things. I dreaded carrying a case of water from the car. I would literally just throw it on the ground, kick it a little bit, leave it. Seriously, I mean, it was that tough just to carry a 24-pack of water, and now I tell myself, calm down. I found myself taking a case of water, throwing it. Seriously, and one thing that I used to always pride myself on when I was sick was attempting to do push-ups. Now, it's still a recovery process, but I can get out a good 30, each rep, so now it just, I look at it like through the roof, I feel great. Yeah.
Sarah, do you want to go next?
No, you're good. So I'm 2 days away, so I was right after Daru, so exactly a year almost. I'm feeling amazing. It's a whole 360. Like Dr. J said, I couldn't breathe. Like before the heart transplant, I would walk laps, but I was glad when my mom was there because she could talk to the nurses for me. And now I love meeting everyone in the city. I'm volunteering and getting to know patients, and I just got my approval to work from Dr. Kim, so hopefully in the new year I'll go back to work. So I'm very excited how well I'm doing, and it's been great getting to explore the city a little bit with my mom and family, and going back to work. It's great.
Neil, do you want to go next?
Yeah, I'm following the trail that they blazed for us, and then Appu will be next. But I feel amazing. I've never felt this good. I had problems all my life. I had an artificial heart valve put in me in 2003, and then it started leaking, and it had to be repaired, but then that didn't hold up very well either. And I found University of Chicago. Nobody around Louisville could do a double, a heart and liver. And so I came here in 2014. I met Dr. Tay, was the first doctor, and Joni Schultz, the intake nurse. And then Dr. Sayre and Uriel and, all these folks. And I didn't know if I would get it or not. And then I think the day I knew is in your office that day. And I've been opened up 4 times. So it was a risk. We knew there was a risk, and I really didn't think I would go through with it. He looked, I can do that. I tell that all the time. And I was like, yeah, that was it. Dr. Uriel, he and I talked, and he said, we know you can do this. And then my confidence was soaring. So I checked in March 26th of this year. I got my transplant on Derby Day, May 2nd. It's funny, Derby Day 1999, I got my first pacemaker and defibrillator, and then 20 years later to the day, I don't know who won the race. I heard there was a controversy over that. I was out of it. But anyway, thank you all so much. But I feel amazing. I'm in cardiac rehab now, which is a little bit delayed, but I can really get on the treadmill. I've never been able to run or jog a mile. I played tennis for a little while when I got my heart valve in. I felt better. I played pickleball, which is a great game, and I played a lot this year already, and I'm getting so strong. And it's a very big, big blessing for me. It's like a big, big comeback. And because I really thought I would die. I accepted it that I was going to die. And So thank the Lord for this life and everybody. And make the decision. If people don't know about organ donation and what they want to do, if you're not totally opposed to it, go ahead and make the decision and do it. If you don't want to do it, that's one thing. But if you kind of, would like to do that, go ahead and check that box and sign it. That way we can all grow and help as many people as we can.
That's fantastic. Appu, you want to share your timeline?
Yeah, I was, my transplant happened on June 21st. I think they sewed me up on June 22nd. So I'm about 6 months out. I feel fantastic. I feel I have a ton of energy. I can no longer say that I was lazy. I was actually just had a bad heart, which is a joke between my wife and I. The other thing is, I think I'm just annoying the doctors right now because I'm chomping at the bit to get out of here, right? You have to be in Chicago, I get it. My family's in DC, I'm ready to go back. So I'm gonna keep saying it. I'm ready and I'm feeling pretty healthy. I'll avoid the infection, but if you'll let me go home, I'm pretty happy.
So other questions, Adriana? Or go ahead, you want to follow?
Well, I just, who can most easily explain, is there a reason why these 3 organs, what is the significance of doing this type of organ transplantation? And what is the significance that these 3 organs need transplants together at the same time? Is there
You want the medical?
someone who, the least medical?
Dr. Kim, can you take that one?
You know, ultimately, these organs are connected together, and I think, it speaks to the human biology and how when one organ fails, it affects the entire body. And the difficulty is when you're trying to, figure out what process is, dominating a particular person's illness, and yet you're looking at 3 organs that are failing. Sometimes you just have to say to yourself, I think we need to fix all of it. And I think it takes a certain individual, someone that can go through the trials and the tribulations of this sort of process. It's a vigorous process. I mean, there's no doubt about it. And like I said, when all the organs are working well, it does come together. When they don't work well, and the heart has to feed the kidney, it has to feed the liver, and when the liver doesn't work, everything else sort of falls apart with it. So I think everything is so connected in the body that it doesn't take much for one system to then affect the other, and it's a domino effect. It really is. I think the other thing for these guys is the amount of rehab and effort that they had to put in after the surgery. I think we talk about, the process of doing the surgery and the teamwork that goes around it, but there's a lot of work that these guys have to do to recuperate psychologically, go through the battery of testing before, the testing afterwards, and really sort of be good stewards of the gift that was given to them. Mm-hmm. And so from that point of view, I think these guys have really excelled, and I think that's part of the process. It's one thing to identify that the organs are failing. You also have to identify the right person that will take care of this gift when it comes up. And I think that's, if not half the story, it may be the entire part of the story, to be perfectly honest with you, when it comes to the key to success.
Thank you, Dr. Kim. Adriana, do you have a question?
Neil, you touched on this, but for Neil and Appu, how have Sarah and Daru inspired you? Do you remember when you heard about their successful transplants, and what did you think that may have meant for you?
It was funny, I was in the battery of testing pre-transplant in January, and you got released in January, is that right? Yeah. And I was leaving the hospital. I was here 4 days for testing, and I saw her and Diane load in the car. I was leaving with my friend, and I had read about this. Did you go home with them that night? Or you were separate?
No, Sarah went home first.
Okay, I saw you guys load. So And then I was not a kidney candidate at that time. In my case, my heart and liver had failed and the kidneys were weakening and getting worse and worse. And then Dr. Tay said, "You qualify for a kidney." I said, "Really?" And okay. She said that to answer the medical question, the kidney will take a beating with the new medications and the transplant. It'll all be a big strain on the kidneys. And they put me on the list. So that made me a triple. And I got so confident and so, pumped, if you will, not a good word, because they had gone through that. And they had been so successful. And then to inspire me, his little boy inspires me, and him talking about it, and that's so honorable what he's doing. But then Sarah came in, she had hurt her foot. She came in a wheelchair and crutches, and I was in my room, and I was recuperating. I felt great. And I said, "Well, I hope you're going to be okay." She said, "Well, I have my crutch here. I can still get my steps in." She's not going to be stopped. A good job, girl. She's not going to be stopped, and I'm going to go right behind her.
And Appu, yeah.
Yeah, I mean, I think it's great to hear their story, right? When my wife and I came here in April, and all you could do was read about Sarah and Daru, right? It was in every magazine, your story in CBS. We Googled everything, we read it, and that was phenomenal to see that it was done. I definitely didn't want to be the first person, or almost the first people. So it was nice to have other people go through it. And then I had the pleasure of kind of being in the hospital with Neil, and so I hate to say this, Neil, but you were a lot sicker than I was, it seemed like, before the surgery. And to watch him go through it, and my wife was there, and we were just kind of like, oh my God, if he can do this, I can do this, right? We used to be in the gym every day, and he couldn't talk, but he would ride the bike. But he wouldn't talk, because he couldn't talk and ride the bike at the same time. And then literally the day we met in the gym after his surgery, he talked for 30 minutes straight while riding the bike. And I was like, holy cow, I've never heard Neil talk, right? I've never really heard him talk. So that was, it's a phenomenal kind of bond. And it's interesting because we're all from different walks of life. We have different interests. We're of different generations. We wouldn't be friends if it wasn't for this. To be honest with you, our paths wouldn't cross. And now we have this bond, and it's not just pre-surgery, it's this post-surgery kind of connection that's really kind of nice, right? The fact that we can text each other, talk about our mental and physical status, I think it's never been heard of before, right? You haven't had 4 triple transplant patients share the same kind of geographic area all at the same time, actually 6 of us. So that's pretty phenomenal. The first one was done in '86, the first one here in '99 or whatever it was. It's like 4 or 5 years apart. Those patients leave and another patient comes in. We're all within 12 months, so it's pretty phenomenal.
Go ahead.
Thank you. So just to piggyback off of your question and then also Appu, what's the recovery process like in terms of from a clinical standpoint versus for a triple transplant recipient versus a single transplant recipient? Anti-rejection medications and on.
So do we want to let Dr. Becker take that one?
Thank you. First of all, thank you all for being here. And again, to our patients and our donor families, thank you for allowing us to be a part of your lives, a part of your stories. It is truly an awesome responsibility that we have, and we feel truly privileged to be a part of all of this. In terms of the rehab afterwards, any transplant patient does have to take anti-rejection medications for the rest of their lives. And as Neil was mentioning, those medications are difficult for the kidney to tolerate. So oftentimes, if the kidney is starting to fail, we say, is this the time to add in that kidney so they can tolerate the medications better for the heart and the liver? The patients do have to be very strong. They have to follow what we do. They have to rehab. It would be easy to sit in bed and not do the laps and not go to the gym and not ride the bike. But our patients have not taken the easy route in any way. They have completely and committed to taking and being good stewards for these organs for the donor families, and they work very, very hard. I dare say, Daru, you can do more push-ups than I can. And so it is a long rehab process, and it's ongoing, but it is a lifelong commitment.
So is it comparable to, so for, like, I'm sorry, so is it comparable for a triple transplant, the recovery process versus a single transplant? That's what I'm saying. Is it
Yep.
more medications?
So
Is it more work?
it's very similar medications. Arguably, recovering from 3 operations is, because it really is 3 separate operations, and we mentioned the operating room, and it has been said that it's like a very well choreographed dance. And some of us do a ballet, some of us do a jig, some of us are doing, but it all works. Somehow it all works. So triple patients do have 3 incisions. So yes, I would argue that of the organs, while I'm the last person in, probably from a rehab standpoint, the kidney alone is probably the easiest of all the organs to rehabilitate from, because it is a smaller incision and just in the, in an easier area to recover from. The liver and then the heart, if you have your chest cut open, it's hard to go through cardiac rehab. So the fact that our patients have 3 operations and work harder than anybody, it's really a testament to their stamina and really working with us.
Great. How about one last question? Adriana.
Sarah and Daru, what do you think what would you like people to understand better about organ donation? Maybe folks don't really get it when they don't have a direct experience like you have.
Pull the mic close.
I'm sorry. The one thing that I would like people to understand about organ donation is it's more tedious than what it appears to be. I remember after Sarah and I had our transplant, I don't really want to call it a hate mail, but there was a lot of hate mail. How did you get 3 organs? And my wife's been waiting on a kidney for 6 years, and I've been walking around with an LVAD. It's a lot deeper than just saying, hey, Neil has a heart that's leaving, I can get it. It's much more difficult than that. It's a lot of art and science actually behind it. So I think that what I would ask people to understand more is to get a better in-depth understanding of it. Read a little more. One thing that I've really been coming across a lot is it's not what you see, it's what you perceive. You know what I'm saying? It's not what you hear, it's what you understand. And that's the thing, people just see the surface, but they don't see the work that goes in behind it. I think that if people see the work that goes in behind it, I truly believe a lot more people would be generous, like, hey, look, this is a big phenomenon. Not even a phenomenon, but this is a great hope that's coming with this, with organ donation.
Sarah?
Can you repeat the question?
What do you want Americans to know about organ donation, or something that you might think people misunderstand about organ donation that you can share?
Well, I would say that if you have a transplant, you can live a pretty normal life. Like the past 18 years, I've graduated from middle school, high school, college, graduate school, and I've been able to create memories with my family and pretty much do anything a typical person could do. Yes, it's a new norm because you have to eat differently or take meds, but I would say if you're waiting, I would say stay positive, do everything they tell you to do so you can be as strong as you can to go into the surgery. And for people who want to register, I would say just seeing us or hearing the doctors, I would say would pretty much convince you to do it. But also I think having the conversation of organ donation more easily would definitely help put the word out there more and let people know what they wanted to do with their organs at then.
Okay. So we're coming up on an hour, so I'm going to, we'll end this portion of the news conference. If any of you have follow-up questions, I think the patients and the physicians have agreed to stay a little longer if you have individual questions you'd like to ask them. But please join me one more time in giving a huge round of applause to these 4 patients.